would.
Monte Carlo.
If you want me to go here, I'd go, but only one. Let's see, what's that,
No,
December?
you can't buy a good used car for $4,800.
I got a meeting on Tuesday also. So do you. Well, here's the thing, it starts at noon.
And I don't believe there's any more material in the
We
car.
could leave right from here after we get done with here and get up there easily by
The other
noon.
stuff is okay.
To just do one day. Yeah,
Got
we
it,
can
so
talk to.
Can't work on them
Well, I'm in
ourselves.
favor of that.
Oh,
and
that's
you're
like
the
all that
chair.
stuff that Gary's new backhoe that he got. They
You
sold
swing
him right
that.
out. Don't monkey with it. You do.
Yeah, I thought
it
you were
could end
going
up
to be
being worse
out
than
west
what it
now.
was. Oh, yeah, then that's a service call from Madison to
Sure.
Milwaukee.
Too wet, yeah. For one, I was thinking about that too, that half a day
You
you
know,
could do.
well, they had a little backhoe, a little O-ring give out. It was track one way.
Sit down and Dennis, tell him to give it to.
Get to that point.
Pass that to Dennis, tell him to give it to Melanie.
I took Riley, or
Little-
we
guy that does, I don't combine them, I have a higher guy to combine. He stopped in today and
Anyway, a little 50-cent O-ring.
beans and been on
Cost
them.
$900. By the time they came out,
They'll drive in a pocket. Another
box
3 or
starts
4
sticking
good days.
out the driveway.
I got seven bunch in my suitcase too. Oh yeah, you're right. He's right in the area right now. And he didn't even start combining
What it
today.
is, well, it tracked one way, but the other way,
Rain this morning.
the jerky was O-ring that was shot. 50-cent O-ring.
Not a lot.
It wasn't the guy that come out did this, he was just a, mechanic.
it all up.
But he had the big service truck and,
No, as long as you clean up after
Yeah.
yourself. She says, I said, Riley, didn't you put the shower curtain inside the bath? Oh, yeah.
probably be late.
Just was I supposed to?
We brought lunch.
Work like that at home. Yes, Riley, you were. Oh, fun.
Ain't gonna change nothing. Oh, yeah.
So what is our, are we passed
Yeah, they could.
Like an opportunity
for
for
them to,
last kick of the cat, so to speak.
okay. Will you, do you wanna explain that to them? Sure. Okay. Randy.
Too pleased with the finance director thing. They like you, Terry. Better get him before tomorrow night.
What's going on?
Not tomorrow night, Thursday night.
Or Thursday night.
Oh, no.
I know there's no dollars in the budget. In the budget. And we'll be next year.
Bees is flying around everywhere.
I got him that night.
Which, on here? Or is it on, in our budget here?
Yeah.
This,
It's in the, under the clerk.
or the clerk?
They're out. Asian beetles are out.
Oh, them damn things, my God.
Get some spray over at Ace Hardware.
Is there?
Spray around your doors.
They stay away from
Come to the yellow jug. Next morning I had a pile of them.
Yeah, it kills them better than hell.
And hornets.
Hornets ain't had big trouble
Those
with.
big stink
Oh, them damn things.
bugs. Comes in a yellow jug and just kind of spray
Around the door.
doors, windows,
Yeah, they will.
inside and out.
Well, Gary got some stuff you spray around the whole perimeter of the house. He said,
It was windy today, that happened.
Pretty good.
I don't know what he called it.
Bottom line, but
Man, there was,
Spraying it around. The second. I realized it's working.
okay.
I don't have any in my workshop. No, you gotta go to Ace Hardware here in Lacombe.
Oh, okay. Okay, I thought maybe Teddy was modern enough to have.
did they find that Korean last night?
Yep. From down by Lake Bernita.
Yeah.
He's got away with it all the time.
He's walking down.
Oh, that's funny. Ready? Okay. All right, it's 7 o'clock. We'll call the meeting to order. Mel will do roll call.
Mrs. Prince? Here. Mr. Heisey?
Here,
Mr. Tim?
Here.
Mr. Cap?
present.
Mr. Eckstein? Here. Mr. Weddy?
Here.
Mrs. Collada?
Here.
Mr. King?
Here.
Mr. Wadel?
Here.
Mr. Rothenbaum?
Here.
Mark Kirschner?
Yep.
All present.
All right, let's stand for silent prayer and pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
so move.
Motion by Weddy. Second by Eckstein. All in favor?
Aye.
Opposed? All right, we'll approve the minutes of the September 2016 monthly meeting.
Will we accept them?
Okay, motion by Cap,
I'll second.
second by Weddy. Are there any questions or comments? All in favor?
Aye.
Opposed, same sign. All right, we have two people wishing to do public comments. First one is Melanie Stake.
Good evening.
Good evening.
Tonight on the agenda, we're going to begin discussing potentially creating a finance director position and/or a finance department. And since I'm currently the department head that's overseeing many of the finance functions of the county, I just thought I would give my input on that subject. Just to give you background on our current finance staff, we only have one full-time county-wide person dedicated to finance duties. And that is County Clerk's Office employee Sarah Lucchini, who's here tonight. And she's been in that position for the last year and a half and has done a wonderful job. Over that time, Sarah and I worked very hard to improve the financial operations of the county. We've done employee training, developed policies and procedures, streamlined the budget process, and improved communication with departments and the board regarding the finance operations. Our efforts have been recognized and complimented by county personnel, our auditors, and by Mike Konechny, who's here tonight to talk about the financial study. My office is and has been doing a good job with financial duties. So why do we need a finance director? We still have a long way to go, and we can't get there without additional help and expertise. With only one county-wide financial person, all we have time for basically are the day-to-day financial duties of the county. We have no time to look at the future and take steps to form a long-term county-wide financial strategy. With a $39 million a year budget, dwindling resources, and increased federal and state requirements, this level of staffing simply isn't good enough anymore. We need to invest in financial help, or it's going to begin costing the county more money through lost grant revenue and other issues we could come into. And I have a specific list of my opinions for reasons that we need a financial person. I'm sure there's many in Mike's report as well, Mike Konechny's report. While I'm very much in favor of hiring additional financial personnel for all the reasons that I will mention in my handout, the thought of giving up financial duties to a finance department is bittersweet for me. From the time 13 years ago that I started with the county, I've done financial tasks, and the current deputy, Megan Kapp, also spends a lot of her time doing finance, and she's doing a wonderful job at that. I've had to become very involved in finance over the past 2.5 years because we've had a lot of turnover in the finance position, some medical leaves for happy reasons, thankfully. And I enjoy the challenges that have come my way. And so I'm not trying to wash my hands of finance by advocating for finance department or finance director. I'm simply saying we need additional financial personnel and expertise. If you do decide to form a finance department, I do hope that you keep my department's office coverage needs in mind. We're already just a 3-person office, and when we have absences, it's very difficult to keep our doors open, which is required of our office by the statutes. Rest assured, I will find ways to fill the large hole that finance operations take in my office. I'll find other things to do. But I hope the board continues to ensure that I have the resources and staff to keep my office open as I'm supposed to. So bottom line, we need additional finance help. I'm hoping that you will support that regardless of if we have a separate finance department or we keep it in the county clerk's office. So thank you all for your time. I hope I kept it to 3 minutes.
I hope you did too. Thank you. You had the timer. So she could talk however long she wanted.
That's awesome.
Okay, Ruth Zowski.
So in an attempt to make these meetings more accessible You had previously decided that we would video record them and put them on our county website. We are attempting now to add closed captioning to those meetings, which means I really need you to speak into your microphones, because the service that we use to like upload our videos will do that automatically, so that Melanie's office or my office doesn't have to transcribe the meetings. But they can't do it if you don't speak into your microphones, because we don't get a clear video. I tried to do it for last month just to see how easy it would be. It didn't work. It then wanted me to type in everything that was said, and I couldn't hear you on my computer. So if we're not going to use our microphones, I'm going to come back and recommend that we don't put these on the website, because you can't hear what's being said. So I'm begging, please use your microphones. Thank you.
I have to share it with Melanie.
I know, we're going to have to bring it back.
Put that microphone down, Bob Ladle.
Yes, Mother.
Pat? Pat? Okay, next we will move on to unfinished business and discussion and possible action items, and we are going to discuss the 2017 budget.
The only reason we have this on tonight is just to give you another chance, if you've had more time now to think about the budget, and if you had any other recommendations or questions, now is the time to do that. We wanted to give you another opportunity before the public hearing.
Anyone?
Did you want me to talk about the bonding?
Yes, please do.
At the last meeting, Supervisor Tim had mentioned that maybe we have to look at refinancing our bond and extending that out multiple years. The executive committee did discuss that at the last meeting and have decided they did not want to pursue that recommendation. But thank you, Larry, for that suggestion.
Pardon me, can you speak into your mic a little bit?
Thought I did. No? Couldn't hear me? No?
No.
Oh. Oh, okay.
Okay, on that note, move on to new business, reports and presentations. We will have our EMS annual report by Director Brian Donaldson.
Thank you. I will keep this brief, I hope. So our annual report, we'll take a quick look at 2015 and just a very brief look at what we might expect in future years. So our mission is to apply innovation within a culture of safety to improve the lives of the people in the communities we serve. We accomplish this through the provision of outstanding health care services, progressive medical education, consumer advocacy, and consumer education. Our vision is to foster continuous value enhancement and quality improvement of health care while being recognized as a leader in the provision of mobile health services. And our guiding values are compassion, dependability, innovation, professionalism, and safety. And the reason I started with those 3 pages was I wanted to make it clear that everything we do, every decision we make operationally, we try to go back to those guiding principles and allow those to guide our daily operations. So 2015, it was a very similar year to 2014, actually. 2,737 calls for service, which was just 1 call less than we experienced in 2014. 72% of those were 911 calls, 26% were interfacility transfers, and 2% were event standbys. The way those broke down, patients aged 0 to 21 years made up 9.7% of our patients. 22 to 30 years made up 6.2%. 31 to 40 years made up 6.4%. So the 0 to 40 age groups, we saw an increase in volume in those age groups. The folks aged 41 through 65 remained relatively unchanged from 2014, and we saw an increase in folks aged 66 and older up to 48.7%. So we did see a significant increase there as well. .4% we couldn't assign an age to. As far as male and female, 51.8% male, 47.2% female. The only real change here was we saw the female percentage go up significantly, most likely due to better reporting, because we only had 1.9% unknown, where in the previous years we had a much higher unknown percentage. So you would expect to see that break out fairly equally between male and female, and it does. As far as resident versus non-resident, in 2015, 65.6% of our consumers were residents, opposed to 34.1% non-resident, and only 0.3% unknown. So again, much more accurate figures for 2015 than previous years because our unknown percentage was way down. Our reimbursement, and this is where it starts to get interesting, 41% of our reimbursement dollars came from Medicare, 28% from commercial insurance, 19% from self-insured or private pay, 11% from Medicaid, and 1% from contracted services. One of the things that you'll see here is this doesn't necessarily represent our payer mix. This represents our sources of reimbursement. So on the next page, you'll see the differences in reimbursement between, we'll say, a self-insured person or a commercially insured person versus Medicare or versus Medicaid. There are significant differences. So the fact that we see 41% of our reimbursement from Medicare means that probably well over 55 or 60% of our patients are actually Medicare patients. The fact that we see 11% of our reimbursement from Medicaid tells me that we're probably over 20%. Our payer mix is probably over 20% Medicaid. The issue is with our current software, it's difficult to pull those figures. So we can pull the reimbursement figures very easily, so those are the percentages that I can give you. We can make some assumptions on how the payer mix breaks out based on those. But as I said, commercial insurance and self-insured pay 100% of our fee schedule, whereas Medicare pays at a reduced rate and Medicaid pays at even a further reduced rate. The contracted services typically pay at the Medicare allowable rates. Our fee schedule in 2015, basic life support base fee was $725. Advanced Life Support 1 base fee was $895. Advanced Life Support 2 base fee was $995. The difference between the two levels of Advanced Life Support are basically how many or the types of advanced interventions that need to be done for the patient. So the more sophisticated cases end up in the Advanced Life Support 2 base fee. The SCT stands for Specialty Care Transport. That's our critical care transfer program, interfacility transfers at the critical care level. You can see the base fee there is $14.95, and our loaded mileage rate is $16.50. If you take a look at the Medicare reimbursement, or rather the Medicare allowable rates, BLS is about a third of what our base fee is, as is ALS1. ALS2 gets a little closer there, about 2/3 of our base fee. And Specialty Care Transport, their allowable is about half of what our base fee is. Their mileage is broken out. 17 miles and less is reimbursed at $11 a loaded mile. When you get to mile 18 and above, it's reimbursed at $7 a mile. You can see if you look at the Medicaid rates, somewhere in the neighborhood of half of what, or Medicaid is somewhere in the neighborhood of half of what Medicare reimburses at or allows. So you can see when we looked at the sources of reimbursement, it doesn't necessarily reflect the numbers of consumers. It was just a percentage of where the money is coming from. And in the case of Medicare and Medicaid both, once we've exceeded their allowable charges, the remainder has to be written off and cannot be collected from any other source. So, because both of those government programs work the same way, once we've reached those allowables, the rest are written off. So that was 15 at a glance. Wanted to look to the future, and I thought I'd find something really cool to put a picture of on looking to the future. And I thought it was really cool until I started reading about the photograph. And this actually isn't the future, this is the present. Not in the United States, but in Germany. What you're looking at there is an automated external defibrillator that's integrated into a drone. It has the capability to fly at speeds in excess of 100 kilometers an hour and has a range of about 10 kilometers plus. It identifies the location for dropping off the device or landing the device based on the smartphone caller being located by the public safety answering point. So the closest drone is dispatched to the caller, and they estimate that it cuts response time to defibrillation by about 90%, where typically it was taking 10 minutes to get a defibrillator to a patient. This can do it in about a minute. So it's pretty impressive. Maybe that's what the future holds for us here, but Germany already has it. The things we're going to be looking at in the coming year and coming years are we're going to let data drive our medical care, our operational decision making, and our strategic planning. The way we're going to do that is we're in the process and have been in the process all year of rewriting our protocols, or what will become known as our clinical practice guidelines. And we're changing them all over from one of the most dangerous things in medicine, or really in any business, is tribal knowledge. Those things that are passed down from generation to generation that we believe to be true, but then we find out when we take a look at the evidence that it can't support it. So we're getting rid of the tribal knowledge. We're trying to support all of our medical practices in evidence. Improved data collection and reporting, as I told you. With our current softwares, it can be kind of difficult to extract some of the information we need to make good decisions. To become NEMSIS 3 compliant and compliant with the state of Wisconsin WARDS data collection program, we're going to be changing patient care reporting softwares January 1. It'll also change our billing software. It'll give us the opportunity, rather the ability, to extract some good data and actually analyze that data. The other thing we're going to do when we collect that data is then we'll look at our key performance indicators. Look at things like response time, times that it takes to get an initial 12-lead ECG in a cardiac patient, times it takes to get a stroke patient to a certified stroke center, times that it takes to get a cardiac patient to a cath lab. And those sorts of key performance indicators, along with some financial and operational indicators as well, and we'll be able to make better decisions moving forward. We've been working with a national software producer out of the Philadelphia area in coming up with a dashboard key performance indicator software package. And as long as they get funding for the next phase, they get the grant for the next phase of their project, we'll become a beta test site for them. We'll become one of their rural beta test sites. We're going to focus on patient and provider safety. And this is extremely important. Part of that is we go back to the evidence-based clinical practice guidelines. We want to do things for the patients not just because we can do them, but because it's the right thing to do for the patient. So that's what the evidence-based guidelines will help with. We also want to make sure that we're referring patients appropriately to the programs that exist, a lot of which are right here within the county. Whether it's through ADRC, Department of Aging, Public Health, Human Services, some other department, or somebody who's not related to the county, when we come across those folks in their home environment and we determine that there's a need, we try now to get their consent to be referred to someone who can help fill those needs. Makes the patients safer, makes them be able to stay in their homes longer and remain safer while they stay in their homes. The other thing we're doing is preparing through planning and equipment for safety of our providers. The new ambulances that will be delivered really focused on safety. They're not fancy, but they have things like brush guards on the front. So if we're involved in the inevitable collision with Bambi at 3 a.m., that doesn't get into the radiator, doesn't cause problems with the operation of the vehicle. The grab rails inside the patient compartment will all be brightly powder-coated yellow. So at a glance, if you happen to be out of your restraint system because you're dealing with something the patient needs, at a glance you can find a safety grab bar to grab onto. The patient compartment restraints for our providers are all 4-point harnesses in the new vehicles, as opposed to the lap belts that were in the old vehicles. So the 4-point harness, much safer. Along with some improvement to the striping package on the exterior to make it more visible as we go down the roadway, and a continuing use of the emergency medical dispatching system that allows us to have a certain percentage of our calls responded to non-emergent. One of the most dangerous things we do is flip on the lights and sirens. Those vehicles are big, they're heavy, they don't maneuver like a passenger car. So we try to avoid the use of lights and sirens whenever appropriate. So those are some of the safety enhancements you'll see coming forward, or that we'll continue to improve upon. The last thing I wanted to touch on was consolidation, regionalization, and partnerships. One of the things we're going to have to do is capture opportunities whenever we can to gain economies of scale. Whether that means we look for other purchasing groups to be a part of. We're already a part of a couple of purchasing groups. But it may be that we can partner with some neighboring agencies when it comes time to purchase additional ambulances or equipment for those ambulances and gain some economies of scale there. We're going to have to, just as in the past, anyone who's watched EMS, if you've been a student of it for the past 35 years like I have, you've seen that the smaller municipalities have had to give up that autonomy of their own ambulance because it's become cost prohibitive to maintain that service. We're going to find the same thing even at the county level at some point as our population stagnates and now maybe even starts to decline a little bit. We may have to find partners outside of our geopolitical boundaries to make the numbers work and provide the services everyone has been accustomed to. And we need to continue to explore innovative opportunities to build partnerships and collaborations with neighbors and with others within the community. So what those are exactly, I'm not certain, but we're going to keep our eyes open and see what opportunities are out there that would be mutually beneficial and bring those forward and see if we should pursue some of those. That's a quick glance at 15 and a quick glance at the future. I think I went past my 3 minutes, but tried to keep it under 10. Any questions, comments? Otherwise, thank you for your time.
Very much. Very nice presentation. I appreciate that. All right, next we'll have Public Health Annual Report and Preparedness Conference Update.
Good evening. For those who don't know me, my name is Patty Wolfile. I'm the director of the health department. So we're going to start with the annual one, which I can see you. Yeah,
it's getting there.
There you are. Okay. So the first picture, if you flip the thing, this is your newly accredited local health department. Waushara County became accredited this year in August. This is our plaque, and I will pass it around for you to see because it's a pretty impressive plaque. So this is your group of people. We are one of 11 in Wisconsin and one of 150 county health departments in the nation. That's pretty impressive that we're some of the first. So if So the next picture, this is the group that was at the site visit, and I know my Board of Health members also were. So you can see we're still smiling. Site visit is national people that come. We had 3 people from 3 different states. They come and ask lots of questions, have looked at a lot of our data. It's a set of standards. There's 12 domains and about 300 pieces of things that you have to prove your documentation for. It's very much a set to follow the set of standards that are national and a continuous improvement plan. So this was us. We were still smiling. Okay, next. So let's talk about what our programs are like. Most of you guys know us pretty well, so I'll try not to make this too lengthy. Every 5 years, we have to do a community health assessment and a community health improvement plan. So we worked really hard in 2015 to review and complete a lot of our objectives and strategies from our last one. And this year in 2016, we have started a new one and have that completed. So, but we got to stay with 2015. So every 3 to 5 years. So next slide. So communicable disease. You're going to find this is one of the resolutions we have tonight. This is one of the unfunded mandates the public health has to do. So if you look at the year, you can see kind of where we go. We stay pretty similar, but one of our highest years was 2015 at 247 cases. So every case of communicable disease, we have to investigate that. Some of them take much more time than others, but this is definitely your tax dollars, levy dollars at work. Next page. So let's talk about the 4 top reportable diseases in Waushara County. Chlamydia. I'd like to throw an antibiotic in the water and tell everybody not have sex for a week and we get rid of that one. But somehow I don't think that would fly. It's probably the biggest one we have, least cooperative group of people, and we have plenty of it. We have a lot of things that you can see my little thing to show, like the ticks and the Lyme disease. We have a lot of things like ehrlichiosis and Lyme's that are caused by those little buggers there. And influenza-related hospitalizations, those were our 4 most high reportable diseases in Waushara County. Okay. So environmental health services. We have an EH staff. We have an EH staff of 3. We're the fiscal agent for a tri-county consortium. And I have someone assigned to both Green Lake and Marquette County besides Waushara County. Mary Robles with me tonight. She's the manager of our environmental program. So we had 42 complaints. Those are the complaints where people don't care what's going on in our community. Like they complain of the garbage next door. They say there's something in their house. They've got mold, lack of heat and water. We have a lot of landlord complaints. That may not seem like a lot, but with all the other stuff that those staff are doing for restaurants, that's a lot of work to do. Okay. Rabies. We have a lot of animals that like to bite. 53 animal bites and quarantine orders. Radon, we did a lot of quality improvement this year. And we're the RIC Center, which means that we're an information center because we have some special knowledge for 4 counties. That includes Portage County along with our other 3. We did a couple of QI projects this year to get more kits into hands. We gave out more kits and we got more results back. So that's a pretty terrific thing. Our county, I guess as far as results, Mary, we're probably pretty average, but we have some high ones. And Portage County is the worst. They have the highest rates of radon. Okay. So food and recreational licensing. This is a program that stands on its own fee structure. This does not take up any of the tax dollars or any of the levy dollars. Our staff charge fees for all of the work that they do. And just in Waushara County alone, there's 270 facilities. Between the 3, we're probably around 900 something. So we have to inspect every place at least once a year, and we do a lot of re-inspections. And the pre-inspection you see is if something new is starting up. And there's a fair amount of turnover. So you can see 159 routine, 16 re-inspections, or 56 re-inspections and 16 pre-inspections. So we always have to list how many complaints we get. We have to follow up on every complaint. And out of all those facilities, 5 complaints. Not too bad. And no foodborne outbreaks. And 92 temporary food events were licensed in that. Somebody that's just short term. So like the fairs and other things like that. So there's a lot of work to be done by that one person in Waushara County. Okay. Immunizations, we offer them in our office and walk-ins. We go to the Amish and offer them. We know that they don't take everything, but we give them what we can, and we go to them. We do flu shots in the community, and we do it in the schools. And we just completed most of our school ones for this year already. We gave 439 routine, 901 flu shots to children in the schools, and 1,217 seasonal flu shots. And this year, I expect that we'll increase that. Okay. One of the things that we've done with our community assessment is that we know that, like a lot of other places, most people die of heart disease or something related to heart disease. We have a high rate of diabetes, and we have a lot of issues with alcohol and drug. So we want to work on lifestyle changes, and I know that you probably all know how hard it is to make somebody change what they're doing. But we like to make our environment more friendly or to explain to people what there is to do. You probably had your kids come home and say, there's nothing to do here in Bashir County. Well, we did a Get Active guide, and that Get Active guide has 83 pages of things to do in Washera County. CHN, which is now Theta Care, and La Clinica and Wild Rose Hospital all contributed and were very helpful as far as partners. We have a lot of partnerships, and you can find it on our website. Okay. So we have tried to brand our community, and branding means that most people don't really know what public health does. We have a Facebook page, we have a website, we put articles, usually weekly in the Argus, we put displays in the libraries, we have brochures, we have a booth at the county fair, we join Blue Ribbons Kids Day and a lot of other special events, trying to get people to understand what we do and what our services are and what public health is all about. But it's one of those unsung places where people are like, what the heck is public health? Unless you've come and had a flu shot, and then you just remember us for that. It's not always the best way to be remembered, right? Okay. So what are some of the things that we do, and how is it trended out in data? Car seat checks. Motor vehicle crashes are one of the leading causes of unintentional death of children under the age of 14. We receive a DOT grant, which gives us some car seats that we can distribute, many of them for free. I have 4 certified child passenger safety seat technicians. And on typical time, you can see it's about 100, somewhere around 100 to 150 checks a year. So that's how many kids we put in safe seats just from our place in Washera alone. We have about 230 births a year. So if we do about 150, that's not too bad of an average of getting kids in car seats. Okay. Oral health, we have a strong oral health program. We do fluoride rinse in the 3 schools, and I should say the 3 school systems that we have school nurses in. We offer supplements to needy families, and fluoride varnish happens in health check and at school-age students. Okay. Bike helmets. Here's another way to prevent injuries. We partner with law enforcement, the schools, and the UW-Oshkosh student nurses each spring to teach all second graders how to bike safely and the importance of a helmet, and we give helmets away. We provide these helmets. We have found that we're a little disappointed at how many kids actually wear them. So I'm thinking that we need to get to the parents next. The kids learn how to ride the bikes, get the helmets, and stash them somewhere. Okay. So how do we do some of the work we do is by mobilizing our community partners. Tobacco Coalition is a 5 counties for tobacco-free living. So we do a lot of youth activities. The compliance checks means we go into the places that sell tobacco and make sure they're not selling to the youth. And we have a First Breath program that tries to get pregnant women to stop smoking or decrease smoking because we know what the effects are on those unborn children. And emergency preparedness, we have a 5-county group that works together in training, plans, and exercises. And we have a healthcare coalition that's hospitals, nursing homes, EMS, emergency management, you name it. We're all together in this process of preparedness and trying to keep everybody safe. Okay. So there's a women's night out. It happens in September in Green Lake, and several staff from each health department helps do that. We have a skin cancer screening. We have a dermatologist who volunteers his time. He's out of Fond du Lac. I'm sure that some of you, I think, have taken advantage of that and know what that's about. And we see him every spring. Central Wisconsin Healthcare Coalition, we have a group that's been working on mental health access through integration and education, and we have moved that along into economic. And we've done a combined community health assessment. So we have multiple committees that increase services for immunizations, trauma care, prevention council, wellness in schools. We belong to a lot of partnerships that help us get this work done. And last but not least, for some things, policy is actually what you need to do to make a difference. Sometimes we educate and educate and educate, and what we end up having to do is policy. You probably remember when you didn't have to wear a seatbelt and other things that have become policy over time, and a lot of that is public health. So we have a strategic plan, and in that strategic plan, we try to follow certain things that we plan on doing. We have a communications team, which helps us with our branding. We We have a quality improvement team, and when we talked about accreditation, that's a huge quality improvement project to always say, are you doing what you should be doing? Is it working? If it's not working, what are you going to do about it? Can you figure out why it's not working and make new strategies to get there? Performance management tracking is the way to look at what you're doing. If you have a program and you take your data, so once again, it's data driven, and you say, okay, this is what we've done, this is what our data is showing, working, not working, do we work on quality improvement? Okay. Enforcement. There's the other one. You have to do compliance, sometimes to make people do what they're supposed to. And in our enforcement activities are tobacco compliance. We talked about that already, that we go and ask if the youth are being sold tobacco. And if they are, then we tell them, remember what the rules are, guys. Food and recreational licensing. Mary is a big part of that program. She is the one that manages it. And we have the 3 staff that do the places in Marquette, Green Lake, and Waushara. Try to keep the food safe and try to make people have the best opportunity they can as far as good, safe food and economics in our area. Lead abatement orders. If we have a child who's lead poisoned, we have the right to ask that to be abated. And so we follow the rules for that and try to do it in the best manner possible, because it's not always feasible financially for people, but there's things that need to be done to keep our children safe. Okay. And linking people to the needed health services. That's a big part of public health, is we don't always do the job ourselves, but we link them to services. Well Women's it's in the regional office in Winnebago now, and it helps people. There's a lot less because of the Affordable Care Act, but that basically helped women get services when they were falling between the cracks for cancer prevention programs. Reproductive health services, we have a partnership with Wapaka County, and we're soon to try to do this independently ourselves, as Wapaka County is pulling out of that partnership. Mental health contract with Human Services for 4 days a week. A lot of you know Melody Simos and know that she's been doing that for quite a while. Okay. So what do we offer as personal health services? We do visits to newborns and families. We do prenatal care coordination for high-risk pregnant moms that are on medical assistance. We have office clinics where people can walk in and ask for what they need for immunizations, blood pressure checks, and other things. And we have a loan closet. For years and years, you might remember we did home care, and now we take that equipment and loan it back out to people. And we do foot care, probably one of our most popular programs. Okay. Targeted case management. Those are MA billable children with intensive care needs, usually comes out of our PNCC program. Health check or well child physicals, and we contract with UMOS. That contract is decreased over time, but we still see the migrant children towards the end of the summer. Blood pressure clinics, we go to all of the dining sites. And the drug disposal program, you can see some of the stats there. 3 out of 4 prescription drug overdoses. 15,500 deaths. These are CDC stats. So we try to do a drug take back twice a year to say, get those drugs off the street if all possible. We do get some of the ones that people are trying to buy and sell, but we get a lot of other stuff. But we get all prescription drugs. That's one of the biggest issues we have, is drug and alcohol. And so you can see how many pounds we collect when we collect those drugs. And it's drugs that we're collecting, so it's pure drug pounds. And where we were, all over the county. Share a Smile is our dental sealant program. We go into the schools and some private schools, and we put sealants on kids' teeth. I have a dental hygienist who works very part-time, and then another public health tech who assists. 52% of them are medical assistants. We usually screen anywhere between 280 and 400 in a year. We had some special needs kids in 2015, and we did 271 sealants and 251 varnishes. And unfortunately, find out there's a lot of untreated caries. There was 110 of those. 3 urgent needs. We do have a special MOU with La Clinica to get those children in. Okay.
Patty, what's a carie? What does that mean?
Oh, it's a cavity.
Cavity?
Sorry.
Sorry.
School health. We have nurses in the 3 school districts. We tend to have about 1,290 students screened for hearing and vision. So, and that's not every school-aged child. That's only a particular grade. So there are more children than that in our school districts. Migrant health generally is our UMOS program. And the school flu vaccinations. So those are most of the things that we do in the school districts. So how do we ensure that we have a competent public and personal health care workforce? We have a contract with UWO for their nursing students. We have done this for 25 years, probably before me. And we get students probably about 6 every semester, so twice a year. And we get some students out of Green Bay and some of the ADN programs. So we are trying to develop the future public health workers. And then our own staff development and training. My staff are very competent and very well trained. Okay. So once again, how do you evaluate your effectiveness and quality of your programs? Well, we're accredited. We have to do a 140 review with the state about every 5 years, and that's based on the statute that says what we're required to do. But accreditation was voluntary, took a lot of work, and it doesn't ever end, because really it is a set of standards that you must meet, and you do that in your daily work. So this is not going away. This is who we are. We're good. Consolidated contracts and state contracts. When we have a contract with the state for any type of a grant, they follow through, make sure we're doing our program right, or they fine you. Performance management programs in QI, we talked a little bit about that. We look at our own programs and the importance of those by data. So things are data-driven, and quality improvement occurs if it's not working well. So now let's just briefly talk about the next thing. In our preparedness program, we're very fortunate that some of the years we've been able to get scholarships to go certain places. And last year, Mary, I, and Ashley went to Dallas. And we thank you for the privilege of that. I know that it was a conversation over the flu vaccine, I think, Donna, you and I had, to say if I gave the flu vaccine, okay, we could go. So we put together just a few things to talk about Dallas. And Dallas, it was several days and probably 1,000 or more participants. And they actually come from all over the nation and internationally. We have people from other countries that come to this preparedness summit. There are so many things to see there, so we certainly can't tell you about everything, but we'll just give you a little bit on what what some of the highlights were. It was called the ABCs of Effective Community Engagement in the 21st Century. That was the theme. So obviously, just like some of the other things we talk about, is how do you get things done, but with the help of others. So I just put that little cartoon on the one side there about quarantine and kind of how scary sometimes this stuff looks, and I'll tell you how scary it is when they start talking about a lot of it. So some of the major themes were disaster mental health, preparedness and recovery, and there was a lot of talk about the Hurricane Katrina. So that was one of them there. So next slide, please. Not going. There we go. So one of the themes was planning today for rebuilding tomorrow and resiliency recovery in the 21st century. Some of the things that I went to showed how after major disasters, sometimes many communities, if they planned ahead before the disaster, if that concept makes sense to you, rebuilt in a better way. Many of them rebuilt as greener communities or communities that had a better concept of how to take care of themselves. You can imagine that when you're thinking about what happened in Florida not too long ago, that the building codes, the concept of what do we do the next time this happens, how do we prepare for this better, how do we make sure things are better for our people as they're going through the disaster. So that's what preparedness for planning today for rebuilding tomorrow is about. And resiliency and recovery is those communities who plan together as partners are more resilient when things happen. Okay. So one of the things I went to was about the Texas Ebola response. So you might recall that when Ebola got to the United States, it didn't get very far, but one of the first incidences was in Texas. And so this was just, you can't read this, sorry about that, but it gives you kind of a flow chart of who was there to respond. It was the organizational chart of who was doing what, and they went through how this worked for them, what they had to do for the Ebola incident in Texas, and how it incorporated federal, state, regional, and local people. Okay. So Los Angeles, you can see that's 4,000 square feet and 10 million people, 88 cities in the county of Los Angeles. and 47 different law enforcement agencies and 26 different fire agencies and 102 hospitals, a lot of community clinics, a lot of long-term care, all came together and planned an exercise. So when you think about how easy it is to figure out a party in your own home or getting a wedding planned, picture all of that getting together. And so they talked about what things worked, what didn't work, and how they could plan for an operational period if they had an incident. And that's what you have to do to actually plan for the future. Okay. Some things come out of this. We get a lot of resources, toolkits for climate change. In Wisconsin, we actually have the BRACE program. We're one of the fortunate ones who got a grant for BRACE. So when you talk about climate change, there's still a lot of naysayers and people that don't necessarily believe that. It isn't really global warming, guys. It's about climate change. But so there's a lot of toolkits and resources that we get going to a lot of these. Okay. There was a lot about schools. We take care of school nursing in 3 schools, as I talked about before. So there was a lot of things about disaster toolkits, psychological first aid, what Psych Start is. It's a way to determine risk in 30 days, and trauma-informed care, which are ACEs, or adverse childhood experiences that lead us to the behaviors that people have that might have people pick up a gun and shoot people. So there was school emergency triage training for school nurses. There was a couple of different things. And many of these places are not rural, but urban. You try to see what you can do in our urban setting, but it also shows you what they're dealing with day to day. They have some pretty tremendous strains that they have with the behaviors and things that go on in schools. Okay. Now, Ashley couldn't be here tonight, but she threw in a couple of things about stuff that she went to, and one was about health equity and disasters. So working with providers to enroll the clients in special needs registries. That's one of the things that we're working on here in Waushara County. We have a special needs registry, and we're trying to encourage anybody who feels that they need assistance when a disaster strikes. Of course, we've explained that we can't get to everybody first, but we'd like to know what the special needs are. So if a tornado hits a particular area, we can go, let's see if we can get to this place, and this place. Bring those with medical access and functional needs to preparedness exercises. Include public safety access and role planning and assessments and improvement plans. So everyone's definition of an emergency is different. And we want to do creative mapping, where the people compare to those things, who has transportation, energy, water plants, hospitals. Our GIS program can be very helpful in preparedness. And health in all policies means that everything you plan for, even if you're planning for a road in a municipality, can you think about how it might affect health? And it might. Exercise, transportation, emergency preparedness. Okay. And then ensuring equal access to points of dispensing. We have what are called pods. Those are our points of dispensing. So for instance, if we have a mass clinic that we need to do, most of our points of dispensing are in the school systems right now. But when we had H1N1, some of you might remember we would say Joe's Parish. So how do you also make sure this is really accessible to everybody? Making sure the aisles are wide enough. Make sure that those with oxygen get there first and get out. Have easy to read forms in large print. Access to multiple languages, because we do have multiple languages. Use pictograms. That's use pictures. People respond to pictures better. Talk to the community members with disadvantages and figure out, what do you need? We don't always have all the right answers. We need to ask people that. And improve information sharing so that we can get the word out better. Okay. Mary.
I focus mostly on environmental and food related talks, and my title is missing from the slide. Sorry. Anyways, this was a food safety presentation from someone who was in a health department in Cleveland. It was actually a county health department, Cuyahoga County, Ohio.
it encompassed Cleveland. So, they decided to do a study to see how vulnerable a lot of their facilities were. And this was mostly retail facilities that serve food, so restaurants primarily. So they chose 24. They had a person who was not really a health inspector go to these places and see what happened. So the primary results are that out of the 24 places, only one place actually asked for an ID to prove that they really were a health inspector. They clocked 9 hours of this inspector total in a restricted area, for instance, in the kitchen and back storage areas where the public's not supposed to be. They had only 2 facilities that had their exterior employee-only doors locked, and absolutely no one was escorted by a person in charge or an operator. So that was really interesting, although I think my area would, or this area would come up with similar results. I do know that most places do have their employee doors open. But what might be different about our area is we have 3 inspectors. They get to know us. They wouldn't necessarily ask for an ID, although we always introduce ourselves, unless, of course, it's more, hello, Tony, you know, we know each other. But that I could relate to those results. But what happened as a result of the study is they created a workshop, and they invited the retail operators to come, and they had a big show of 218 operators, or at least attendees. They developed checklists for these operators, like a checklist for the manager to use, a checklist for employees, and a visitor check-in form. And so they gave these away at the presentation, so that's very useful. They were giving them to the attendees at this workshop. They also told operators about the FDA's website, which has mitigation strategies. It's a database where you can plug in if you're a bakery, if you're a restaurant, if you're a temporary mobile food facility, and the things that you can do to protect your facility from intentional sabotage. That could be someone who is a disgruntled employee, or it could be someone with some other goal in mind of ruining the reputation of the restaurant. So that was a very interesting presentation. Next. Okay, it's missing also. This was in Westchester County, New York. Well, actually, this was in the city of New York, and it had to do with Legionella. And in 2015, there was a major outbreak of Legionella. And the New York City Health Department really couldn't handle this project by themselves. So they solicited help from area health departments, many, many health departments. And only one county, Westchester, New York, Westchester County, New York, came to their aid. And what was interesting about this is how Westchester got a lot out of this. The person who put on the presentation was from Westchester Health Department, even though this outbreak occurred in New York. They got a great experience out of this because they had all kinds of new trained people to investigate in an outbreak. And so they got a lot out of it. But what happened was the health departments joined together. New York City Health Department did some training of the volunteers that came from Westchester. The volunteers had to, have some criteria. They had to have an environmental background with sampling and inspection experience. They had to be in good physical health. They had to have been fit tested, and they had to go through medical clearance. They couldn't be afraid of heights because these cooling towers are on buildings, tops of buildings. And they had to be willing to accept a certain potential environmental risk to being involved in the project. So they took volunteers from this health department. They had nurses and environmental staff. They helped the city of New York get an inventory of all the towers that were out there. They did that by looking at maps, by looking through other databases. They had to go and actually confirm that these towers still existed through interviews. and they had to team with the police department, the fire department, so that they could get access to the tops of these buildings. And so in the end, after the investigation, they did find the source was an Opera House Hotel cooling tower, at least for that outbreak. And the state enacted emergency procedures. They required everyone to register their towers within 30 days, to sample their towers, and to come up with a maintenance plan and every 3-month inspection plan. And so that's what happened. It's in an emergency rules, but they are also going to likely come up with something more permanent with fees, permitting, and inspections of cooling towers in the state of New York due to this. I was just on the New York City website today and saw an article about another cluster, Morris Park, unrelated to the Opera House cooling tower. I wasn't exactly sure the date of the article, so I don't know if that's happening now. Okay. So I really appreciate having been able to go to this and to actually see some environmental projects that I could understand, and they were really hands-on presentations. So I mean, experienced by people who were right involved in the work. Thanks.
So I think there's probably one more slide, Deborah. Okay. So one of the things you want to know always is that whenever anybody goes to something, that they have some take-homes, that it isn't just that, hey, gee, we went to Dallas, wasn't that great? So the take-home considerations, I named a few. There's certainly more than this, but it's like, in our case, include the faith-based community groups in planning, listen to people more, have MOUs with people, get our ties to the community groups stronger. We know that in our smaller communities, we tend to know each other. We tend to have a lot of people who do the same things. We tend to have some really wonderful volunteers, and we know how to get things done. And that's the group that we need to be using for a lot of our projects. And when I talked about trust within a small community, Build by Design was part of the conversation in a couple of those sessions where they talked about how if the community works better together and if you use local people with a lot of your projects, rather than some expert comes from somewhere else and says, here I am, here to help you, that doesn't always go over well. You tend to trust each other better and you do better together. So at the county fair, we set up preparedness education info. We make this one of our focuses, and this last year we did it with a special consideration for the elderly with a kit to help them figure out how to have their own plan. Just as I said, we can't always get to everybody right away, but we can certainly try to educate as many people as possible and say, have your own personal plan and have things put together in your home and be prepared to take care of yourself because you're probably going to have to for a while. The Amish, do they have an evacuation plan? Are they all going to jump on their horse and ride away? But there are things that we have done with the Amish. We still need to do more. When it came to smallpox vaccinations and we were considering that that might be a disaster that would happen in the United States, we sat down with the deacons and said, would you even take them? And it was a resounding yes. And we had a plan for that. I don't think that's going to happen anymore, guys. They should have done that a long time if they were going to do something. We're pretty prepared for people to do smallpox. But it means that there is a way to work with every community and every group and use their strengths. They have a wonderful grapevine. They know how to get the word around faster than anybody else, and they're a very cooperative group of people. Equity and response. Make sure we're doing the same for Hispanics, elderly, and the medical needy as we are for anybody else. Make sure we're thinking of everybody when we design things. Educate our citizens to be prepared and not expect rescue. I already mentioned that above. There was a childhood tornado book. The gentleman that spoke for this one had survived a tornado with his family, and it directly hit his home. He had read books when he was a kid. That was kind of his thing, and he actually loved this tornado book. And it explained how tornadoes tend to go and which direction they tend to go. And he was on his way home when the tornado was hitting, and he could see where it was going, and he could tell, even though most people told him, you just get in your basement, you know, he knew it was going to hit his house. And because of the stuff he read as a kid, and it saved his life, and he's done most of his work just trying to help other people past and through disasters. Build relationships with Medical Reserve Corps. There's a lot of groups out there in Wisconsin and nationally that help people out. The schools work on the psychological first aid courses. What do you do to help people when there's a disaster, how people are going to respond, what you can do to help, what you're looking for. Schools for Trauma-Informed Care. This is looking at how people have grown up with trauma and how they're going to respond and how we can work better with that group of people. Climate forecast, I already told you about that. Areas of high tornado risk or those with high flood risk. There are maps and things out there for all kinds of places to say this is what you should be prepared for. So when people build things, so for instance, those places that flooded for New Orleans, I'm sure that when they rebuilt or fixed things, they thought about that. And if we can think about that before it happens, when we're building things now and go, are we thinking of everything? So, hospitals designed for storm runoff, flood damage, that type of thing. So there's a lot of take-home considerations when you looked at the stuff that happened in Dallas. So I think that's the last one. So once again, thank you for the privilege of going. And thank you for your attention tonight.
Any questions for Patty? I have one. Are you doing the flu shots yet?
Yes. And I'd be happy to give you yours.
You always volunteer to do that. Thank you, Patty. All right, next we are going to have our county financial system study results, recommendations. His first report is going to be how comfortable his benches are that he's sitting on, right?
Yeah, that's fine. Good evening.
Good evening.
Thank you for having me on your agenda tonight. I know I spoke to the county board, I think it's been a few years, but like Donna said, I'm Mike Konechny, I'm with Schenck, kind of a large regional CPA firm in Wisconsin, and we have a kind of a unique governmental department. We have about 40 of us that just do government accounting, auditing, consulting in Wisconsin. We currently work with, I think it's 31 counties. So, and I've been around a few years, so I've been working with counties for over 40 years in Wisconsin. So, a little bit of history. I think I've been with Waushara County, I think in the early 90s or around 1990. So I've been here a lot too and seen changes in the county's operations. The report that you have, you should all have a copy in front of you. I don't have a PowerPoint, but I'm kind of just going to walk through. I'm not going to read this to you, but I'm going to go through some of the highlights of the report. The report came as a result in May and June of this year, talking with your administrator and administrative coordinator, and then the executive committee about, where is Waushara County right now in financial systems? Where should we be heading? Let's look at this systematically and come up with some recommendations or possible potential changes. In the introduction letter there on page 1, briefly explain what we did. We did we call it an assessment, kind of a review of all the different financial systems of the county, procedures, including all county departments, as well as what we call the general county finance. And we were kind of looking at, what we were looking at was really 4 different sort of items that we considered a finding. Were there duplicate, unnecessary, inefficient, time-consuming procedures? Were there internal control things that maybe displayed a weakness or a system where there was maybe not the most tight internal controls? Was the type of financial information that was being generated, was it useful, or was it in the best format? And was the timing of the financial information good? It wasn't months late or just had unnecessary delay. And as part of this, we surveyed all the county departments, and we also surveyed the county board, and we thank you for your responses there, just to get some general information that we use. And then we met with some of the key, some of the larger county departments and reviewed the results. And on the following pages, let me just give you a little, before we get into that, I'll give you a little, I've been working with Wisconsin counties since the mid-'70s. And when I came in, and you can imagine, anybody around in the '70s here? Just kidding. I was anyway, and a lot of them, most counties were manual systems back then. Not all of them. There were a couple that had started to do automation, big ledger books, handwriting checks, posting them in books. All of them were decentralized. Departments did, highway department did what they needed to do. Human services didn't even exist back then. They were social services. Anyway, pretty much what you would imagine. Since about 1980 is when counties started to change. I would say from 1980 to the year 2000, most counties really looked at created financial departments, finance directors, worked towards centralization, more use of automation, more county-wide policies and procedures rather than each department doing their own things. They also looked at more at long-term planning. That was something that maybe governments would react year to year, but they said, hey, let's look 5 years out, 10 years out. When are we going to need new buildings? How are we going to systematically keep our roads in condition? So that's really kind of the history of it. And in summary here, just to get into the report, we feel Waushara County is a bit behind some of the other counties in Wisconsin and some of the other governments in implementing some changes. And starting on page 2, I just have a couple of comments there. They're quite sort of long, but I'll kind of go over the highlights of them. Summary of the present situation. Right now, and as Melanie said prior, the county clerk is generally responsible for the what we call general record keeping. Your budget and recording expenditures and revenues to budget, monitoring systems like that. Your payroll department is a little bit different because it's integrated with the administration department with some other things, which is a bit, I think maybe a bit unusual, but that's the way it was growing up in Waushara County. In our opinion, things are operating, the basic accounting systems of county are operating adequately. Everything is accurately recorded, getting done on time. But what we're saying here in the second paragraph, the county has not developed what we'll call additional county-wide financial system enhancements or improvements that are regularly used in other local government financial systems. And then I list about 8 or 9 things there. What do we mean by that? What are these enhancements? What are these improvements? Development of a county-wide invoicing and accounts receivable system. Now, in general, all your departments have do services, bill them out. It's pretty decentralized. Each department is kind of handling its own system. The software you do have right now purchased for general accounting has the ability to implement a county-wide accounts receivable system. Now, you do have some specialized systems like your ambulance service and some of the human service things that would need to be separate, but there's a lot of other accounts receivable that could easily go through a general accounts receivable system. Electronic transfer of data from one financial system to another. Now there's some significant rekeying, re-entering, putting things in Excel from one system, transferring it to another, re-entering it. That's sort of an obsolete way to do it now. Now you can download things and upload into another system, or just an integration of data from one system to another. Scanning policy. Many governments have a policy and procedures to eliminate the physical transfer of documents. Scan it, it's in the system, other people can retrieve it. Federal grant policies, there are some significant changes to how federal grants need to be monitored, that we're working with almost all of our clients that have federal money coming through, and the county has a considerable amount of federal money, that there's additional controls and documentation that needs to be done for federal grants. Long-range capital improvement plans. I know obviously you have some general ideas on highways and building projects, but to actually structure that into a formal capital improvements policy, we feel that's important. Completion of service cost analyses to justify changes in appropriations or service levels. You know, how do you know, are you efficient at doing things? I know your EMS director talked a little bit about performance indicators and things like that, and that's what governments are doing now. And you know, these are things private businesses have done, you know, a little before governments. Governments are generally a little slower than implementing things, but you know, develop, what are we trying to do here? How can we be more efficient? Well, you got to have a cost analysis along with some statistical analysis. Goals and objectives in your budgets. Many governments have developed each department would have their goals for the year and a way to measure them and different objectives what you want to accomplish in the next year. These are just things that are happening out there. It's how you get better, how you get more efficient. And then increased use of electronic payments and electronic receipt of money. You know, writing checks is becoming more and more obsolete, and receiving money, especially from governments. People want to have electronic transfers, wires, electronic payments. And you do some of that, of course, but there certainly can be more of that is available to do. And it can be more efficient, obviously, than handling a check, depositing, that kind of thing. So we feel some of these things here that I just went through have been adopted by county departments to some extent. But we feel the county is better served by creating a county-wide policy initiative for doing many of these things and coordinating it centrally. The county department systems, just briefly talked about, as I said, we looked at that and we were quite familiar with them in a lot through our auditing procedures. We feel there was nothing like significant issues with any of them per se. But again, we feel they would be better enhanced by having a county-wide focus on this. Our surveys with the county departments and some of our further discussions with them indicated there's about 20 things I think that we listed where we felt, and they're listed on page 4 and 5, I think, of this report, where we list a number of things, subsystems, and we kind of listed them by department, saying it's either a manual process, and by manual process I sometimes mean Excel can be used, you know, as a record-keeping thing, but it's really sort of a manual process because you're keying it in. Time-consuming, inefficient, and there's a number of them with internal control efficiencies, we're calling them. That's generally with accounts receivable policies, because you want to, ideally with accounts receivable, you want to separate the billing function from the collection function. And generally when you're having a county department do a lot of that, it's harder to separate that. You can with different employees, but when you have payments directly to a county treasurer, you obviously do have that separation. So anyway, those are the things. Each one individually does not indicate a major problem, but having a lot of them, you know, it's things we feel you would need to work on. It's really the decentralized approach and fragmented approach that was used to improve these systems. Then getting into the recommendations, and hopefully you've had a chance to maybe read through this prior. On page 6 of the report, we would rec establishment of and I'm calling it a centralized accounting or finance office. Ideally, I would probably be in favor of a finance department, separate from all other departments be created. The finance department, I've seen these develop over the years, many of them actually, and in our opinion, the best ones we feel are where the finance department is responsible for all accounting systems and financial procedures of the county. I think Melanie mentioned you're a $39 million operation. We feel that operation should have one centralized chief finance officer. That's a lot of money being spent. And although because you're a government, obviously your departments have totally different missions and purposes, but you're still all Waushara County. And to have one centralized finance office and one authority over the financial systems and processes. Now that doesn't mean, just to clarify, that doesn't mean all of a sudden everything's going to run through one finance office, but we feel one finance director and office should be aware and have like sign off or approve the financial systems being done throughout the entire county. Again, for internal control, for use of automation, just for efficiency and consistency. And that's kind of what I'm saying there. It doesn't to start something like this out. I don't believe you need to like build a building, add on to this building. A number of counties, and I've talked to your people about this. Door County, Shawano County are two that come to mind that I've worked with over the years. They created this, didn't really change anything in day one. They did designate a finance or accountant or accounting people. They stayed right where they were, and over time, as space became available and different personnel were added to that department, generally not added bodies, but transfers from people that are already here, they have created a finance department. And it was, relatively easy to do, but they established the authority in a resolution and then started to build a structure. Slowly. You don't need to change the world here in a week or two, but over time develop that. And in my opinion, there were significant improvements in those counties by doing that. And that's really what number 1 says. The accounting system improvements we talked about in number 2 that we feel are significant. That accounts receivable system, the county-wide receivable system, we feel that should be a high priority. Payment of county expenses. You do have a wide variety of procedures out there as far as for paying bills and processing bills within the departments. I think that would be another area to look at, to try and streamline that. And then you can get into scanning, transfer of information, approvals, that kind of thing too. I would just, I know there's additional efficiencies that can be obtained there. And then just to go through the rest of it there on page 7, increased use of centralized collection. And this is where I was getting at, to have departments, as I say, generally can process an invoice, but the collection then would generally come to the county treasurer. You do have that now pretty much in highway. That might be the only one where that happens, I think, a lot right now. And development of data processing systems and department applications. You do have, some of your county departments do have separate computer systems. I know your human service department has a number of them that have been mandated by the state. They're part of a statewide program and statewide system. Your highway has a separate system. I know your health department has systems. Your ambulance department has systems. That's fine. They need them in a lot of cases. But again, we feel that the finance officer should be, like when these things are being talked about to implement or purchase something, we feel the finance officer should be involved in that decision. Because there may be something county-wide that can work. There may be some, a different process that should be considered too. So that's just that the county should look at establishing procedures for determining data processing enhancements or additions, and just have the finance department as part of that process. So that's all. I mean, it's a short report, but I mean, there's kind of fairly significant recommendations there, and I know you have plans to discuss this but I'd take any specific questions or any ideas you would have that I can answer.
Yeah, I have one. On page 4, when you were going through it there in the patient accounts receivable, and it says collection procedures inefficient and not separate from billing function. And then you turn over to the page 5, and on human services outpatient billing and collection, entry into 2 different systems. And I'm not quite sure what the 2 systems means. And
yeah. I'd have to look into that second one there. The one with patient accounts receivable or on ambulance, that's where I'm getting to. There can be a lot of electronic payments from most private insurance companies prefer to pay that way. Medicare and Medicaid want to pay that way in a lot of cases also. And that can be explored a lot more to separate the billing from the collection and then be more efficient for everybody. But you got to have a system for it. You can't just say we're going to do it and it'll work out, because there's a lot of transactions and a lot of that. That's where I'm getting with that. The outpatient billing and collection and human services, I'll have to get back to you on that. I don't recall exactly what 2 different systems. I mean, they're entered into the human service system, and they're also in some ways entered into the general county system. I think that's electronic transfer of information there is what we're talking about too, to eliminate the duplicate entry.
Just curious.
Our human services financial person here, do you want to?
Right, and it's, again, it was just talking about electronic transfer of information, because it isn't automatically then rekeyed into the county's budget system, or it isn't automatically flow into there. It needs to be rekeyed, so that's what we.
Any other questions?
Anybody else? Just to repeat before, we feel you've made improvements over the last few years with the new budget and accounting supervisor in the current position. But we feel there's so much more you can do and should be doing to provide better information for the county to move forward. No question about it, in my opinion. Okay. You're welcome.
Deb, did you have anything you wanted to add?
Do you want to wait till you do the item? Okay, thank you. At the recent executive committee meeting, we talked about this a little bit, and we chose not to bring a resolution to you tonight because we wanted to get some input from you. Some of the thoughts that we had is because so many of our positions have been developed over time, and they might have a component that is financial related, but then they have other duties. So there is no one easy, swift movement to start a finance department, right? Because there's so many different pieces to that. So one of the things we talked about is, and I think Mike touched on this a few times, it's looking at the integrity of the processes, giving somebody that authority to really look at things, to make sure the systems are right, to make sure we're doing things efficiently. And so we talked about perhaps bringing a resolution that would create that authority, basically. And then let the staff this would evolve over time. It would take time for us to decide which positions need to go into that department. Human services, just in that department, they have probably 5 or 6 employees that deal with finance. Highway has 2. Health has 1. Deb Pavla has to do all her own, but she does a lot in the accounting area. I have 3 different staff that do pieces of payroll, and so payroll, it would be something that would have to go into the finance department. So this is going to evolve over time. So basically the discussion tonight, I think, is, do you understand the concept that we really need to improve our processes? And that's one of the big steps here, is that instead of having 20 different departments doing 20 different things, we're going to start getting into a centralized mode. Again, it's not going to happen overnight. It's going to take a long time. But take that first step in starting the county down that road. And that's what I want to hear your thoughts on.
You're talking about creating a new office along with new positions. I haven't heard either you or the gentleman talk about eliminating any of the current positions to offset this, because as you give us speeches day after day, meeting after meeting, we don't have the money. Bottom line is, where is this going to come from, this new position, this new office? Are you going to streamline some of the other employees or maybe combine them into this office? Or are you talking new hires and new?
I personally do not think that it has to be new hires. I think that as time goes, as we review these processes, you're going to identify the positions that are a natural fit into a finance department. But the first step really is to give somebody that authority to start looking at these processes. And so we talked a little bit about at executive that perhaps maybe the first year we don't necessarily hire a position, but we contract with someone like Mike Konechny to come in and start looking and reviewing this and making those recommendations for us on what to do. Because again, just in my office, I have 3 staff people that over the last 25 years, their positions have developed with a piece of a financial component. And so we have to unravel all of that, and that is going to take time. So we're really not suggesting creating any positions right now. It's starting to look at that process with the thought that we are going to make our systems consistent throughout all the departments, if that makes sense.
The way I look at it is departments are they're kind of doing their own thing and have been for a long time. The financial person will consolidate that, and they'll all be working toward the same goal in their financial workings. So do you have any other, Larry, do you have a question?
No, I think the concept sounds good, but I don't know if our county can afford it. I checked with the county, or the got from the Counties Association just recently. And only Winnebago, Wapaka, and Portage have financial directors. Adams County, Marquette, and Green Lake do not. And the three counties that have the financial director, I think, are larger counties. They have more valuation in the county, and they're in a better position to afford it.
Okay, I understand what you're saying, but in the counties that you mentioned, they have given their administrator or administrative coordinator that authority to make sure those systems are in play, that they're set up. So even though they might not have a separate independent finance office, they have centralized those processes with their administration.
I haven't delved into, how those other counties
Yeah,
operate.
I know Brenda from Marquette County. The gentleman from Adams just quit, Thad, but they were the finance person, so they've done it in a little bit different fashion. But they've still centralized it, and that's what I think that's the important piece of this, is that right now you have 20 departments doing basically 20 different things. I guess, the executive committee had asked Ruth, Melanie, and I to sit down and come up with a resolution to bring to you. I think it's important to hear what your leanings are, to give us a clue on even how to approach this topic. So, and again, we don't necessarily have to create a position. It is creating that concept that you are going to work towards centralization. The executive committee, when they were preparing the budget, they put money in, they transferred it from surplus, but put it into the 2017 budget to help pay for time to do this, whether it was a position or whether we were contracting some time, because there's a lot of expertise that's going to be needed to get this thing on the right direction, and so that's why we had discussed that perhaps we contract with somebody on a part-time basis to come in and really evaluate these systems and then make recommendations to us on what positions need to be transferred and what systems need to be transferred.
You can't keep taking the cost of this out of surplus.
I understand that, but that's a temporary 1-year thing to give us time to let this evolve.
At a couple of the seminars that I was at, in the way that the places had done it that I was listening to, they had changed over as well and added a finance person in there. And what it did by bringing that finance person in was, instead of having all these little pieces here, there, and everywhere, and I'm not going to get at anybody, but when you have a budget before you and you take some money out of one thing and spend it for something else that you're supposed to be saving it for, you run into trouble. And what that one finance person does is they go looking at other places where they can find it and not have to mess that up and cost twice as much money. And what it does with the one person that can oversee the whole thing is it takes and it smooths everybody out. Everybody's part of the group instead of 10 little different groups on their own.
Well, and this also will give help to those departments that don't have a financial person, like aging, Commission on Aging. Deb mentioned that Debbie Pavla has to do all of that herself. She does her own budget, she does the financial. So this would be some help to her as well. And not just her, but other departments too.
That's it. You're right, Bernadette. That is not, and I like Sarah way too much to put this all on her shoulders. That's why we're saying we need to ease into this, because you have 20 different departments in silos. Yes, there's a lot of cooperation. We work very well together, but when it gets down to that dollar, it's, we're going to have to start doing priority-based budgeting. You really have to have a good handle on this stuff. And that's why I think it's the concept of centralizing it. That's what I want you to focus on. How we get there at the end of the day, it could change over the next year, because it's going to take some time for this thing to evolve. But are you on board with the concept of centralizing finance, so that those 5 people in human services really don't work for human services? It might take a year, it might take 5 years, it might take 10 years, but eventually that it's in a centralized system, so they work for Waushara County.
What are you looking for from us?
I guess just, are you on board with the concept of breaking down those silos and centralizing financial as much as we can? I guess that's what I need to hear from you, is if you're on board with that concept.
Motion to look into this further, is that it?
Well, I guess we're supposed to write a resolution to bring back to you, and I would really like to have some idea on, we've seen examples of resolutions that are to create a department and actually start staffing it right away. We know that that's too much. So are you okay with creating the department and the concept of starting to centralize this? And then it's going to take, again, it'll take time. There'll be more recommendations coming down the pike, but it isn't a matter of hiring a bunch of new people. It's realigning the people and the duties we already have.
I'm in favor of streamlining this whole process. What I'd like to know a little bit more is how the streamlining would take place with 20 different departments. As I look through this report here that Mike presented, it talks about manual process, Excels, all kinds of different ways, and I'd like to know how these are going to be blended together, and also how it would affect each of the departments that already have a financial person in place. Some of the departments do have that.
Right. Well, one of the things to me that I think is a relatively easy fix is to look at a county-wide accounts receivable plan. That's generic enough that most departments can use. And Springbrook, who is our general ledger provider, they do have that, that type of software. So I think that's a relatively easy one. So you're getting that into a system where everybody's doing it the same way instead of everybody doing their little separate billing. And this isn't a specialized, so this wouldn't help EMS. It's not going to help human services. But almost every department has some sort of billing that they're doing. And so once that's in that centralized system, then the money can get collected by the treasurer's office. It doesn't have to go to that department first, to be documented and then send to treasurers. That's a real, to me, is one of the more simple things that we can fix. This is why I really would encourage you to seriously think about hiring Mike, on a part-time basis. He's got the expertise, he's got all the years, he's been in the county system, he's seen other counties, how they do it, that he could really give us some really good guidance on how to do this. And then it gives it the time to naturally evolve without moving a bunch of staff around.
Mike knows what works and doesn't work, and that would be a huge help to us in setting this up, I think.
And Melanie mentioned it, we've built these positions based on doing a little bit of finance. So, her 3 staff people, I've got 3 staff people that, if you just move these people out of our systems, I don't know what we would do, because there's so many other things that these people do. It's got to take some time to evolve, because otherwise it's really going to be a nightmare.
So this would not jeopardize positions that are already in place.
No, no. Things that, it take time. It would take time to evolve and to really see what makes sense. You know, and it maybe eventually things will get shuffled around that people can be transferred into that finance department, but it doesn't have to be that way right away. Number one, we don't have a spot to put a bunch of people. They're gonna have to be spread out for a while because we don't have the building space to do that. So, it's the integrity of those systems. That's the important piece of this, is that we're doing it the same way, we're doing it consistently, we're being efficient in how we're doing it, and that's what I want you to take away from this.
Every department has their own system now?
Well, there's just a lot of manual things going on. That's the piece that's difficult. So they're doing things on Excel spreadsheets. It's not in a main system anywhere. So then there's a lot of.
We all have to get new software for all this.
No, not necessarily. I think one accounts receivable package will take care of a lot of this. And we've talked to Springbrook about it already to see what that would cost. And
If you formed this, Deb, wouldn't it give some of these people that you're gonna maybe move, give them a little bit more time where they might be able to get involved in something that we have been missing and hasn't been done?
exactly, you don't know. You don't know.
I'm just saying,
Yeah.
you know, if you go and adopt this, you know, there might be some things that they haven't had time to do, and maybe we could free up a little bit and pick up some things that maybe we're missing. I mean,
Go for it.
Okay. So are you okay with just the concept then of a centralized finance? Okay, all right, without changing a bunch of staff and moving a bunch of staff around? Okay, all right, well, that give us enough guidance? Okay, all right, we'll bring something back next month. Thank you.
Thank you. Thank you, Monica, I appreciate it. Next, we have the administrative coordinator versus administrator.
This almost sounds like a wrestling match,
Yes,
doesn't it?
does. I was going for boxing.
Oh, boxing?
Administrative coordinator.
All right. Well, we had actually gotten quite a bit of information from Green Lake County because they actually just switched. So their administrative coordinator was attached to their county clerk position, and they're just going with a full-time administrator. They just made an offer to somebody just recently. So they're just in the process of making that switch. So luckily, Jay from UW Extension had just done an analysis, so I just grabbed it to show you. So the county went with administrative coordinator position in late 1988, and they hired me, and I started in 1989. So I was the first full-time administrative coordinator for the county. My position had attached to it a lot in the human resources area, so that was a lot of what my focus was personnel policies and those type of benefits and dealing with labor unions, and so that's what a lot of my time was. And then I was given the responsibility of the day-to-day operations, and that part of it's in the bylaws, in the county bylaws. So I'm leaving, right? I'm going to be out of here next July. And so I thought this was the time for you guys to really have that honest discussion about, do you feel like it's time to take that next step to go with an administrator form of government? So I wanted to show you what some of the changes are. The big things to me are that an administrator actually submits the budget for county board approval. So an administrator prepares the annual budget. And then, you guys can set the parameters, do all of that kind of stuff, but the administrator actually does that. The other thing that an administrator does is supervises the non-elected department heads, or department heads that aren't appointed through some other statutory means. So that's another big change. So I thought, since I'm out of the equation, you guys have a fresh slate. You're going to hire who you want to come into that role. You're going to set that job description. Now's the time to have that conversation, because, you know, it takes that personality out of it, whether you thought I could do it or couldn't do it. That's out of the conversation now. You're starting with a fresh slate. So, so I think we're at that point. I think I would like to strongly encourage you to consider going with an administrator. It's getting more and more common throughout the state. I think with the difficulties of what's going on in the budget world and tax levy limits and things like that, that administrator is going to make a lot of tough choices. And of course, you know, the county board has the A or nay at the end of the day on the budgets, but there are tough choices that are going to have to be made. So I would like to strongly encourage you. I know department heads, we've talked about this at quite a few of the department head meetings. I won't put words in anybody's mouth, but most of them seem to think that we're at that spot, that we should go with a county administrator. But anybody that wants to chime in, I think, go ahead. I brought some samples of like job descriptions. We talked about, you know, what would you want that administrator to do? And again, you know, the budget's a piece of it, but a lot of administrators do human resources. You know, everybody does it a little bit different depending on the size of their county. So there isn't just a one size fits all with an administrator.
Borowski, when he was here, did a presentation on this, the differences between, and he did make his PowerPoint available to us. So if you would like to look at that again, Deb has that. She sent it out to a couple of us that asked her for it. So, you know, if you're interested in seeing that PowerPoint, again, to look at it, study it a little bit, and see what you like and what you don't like, I'm sure Deb will send that out to you. Just
Happy to.
give her a call, and I thought it was very helpful, his presentation. I'm sorry, Deb. Yes. He's wearing a gun, of course he can say whatever he wants.
I've been with the county since 2003, and before I was sheriff, I was involved with administration in the sheriff's department. As far as being a department head, tonight you've got two things in front of you. You've got this financial piece that you've talked about, and you've got this administrator piece that you're talking about. I think for the department heads, I'll speak for myself, not anybody else, but for the department heads, I think both of these positions or both of these thoughts would be in the best interest of the county. I think it makes it easier for the department heads to know when they're talking about finances, they're dealing with one person. When they're talking with, you know, other things that Deb talked about, it's nice to deal with one person. And I think it'd be in the best interest of our Share County to move ahead with an administrator. It's my opinion, but from being involved in the process, I think that's best for the whole county. Thank you.
Another thing you might want to look, Deb and I both attended, and I think Mike did too, the priority budgeting. That's very interesting. That we were down at WCA, and it's something we need to, I think, look at in the future. The PowerPoints presentations are on the website, the WCA website, if you're interested in looking at them. But I think, you know, it's time, you know, to, you know, look at the priority budgeting. So, I also attended a seminar on mental health in the jails. That's pretty scary. Very scary. Definitely that too. All right. Any comments, questions concerning the administrator versus administrative coordinator?
I'd really appreciate hearing from you guys. I mean, this is an important discussion to have. And if you know, you can be against this too. That's okay. But I really need to hear your thoughts, your concerns, your questions, what more information you need.
Russell?
If we would have created this position while you are in the position you're in now, would you stay in that position or would we hire somebody new?
Are you asking me would I work longer?
No,
Okay.
I'm asking you that if we would have created this position 3 or 4 or 5 years ago, would you be eligible for that position and stay in that position, or would you be out the door and we'd hire somebody new?
If you would have done this a few years back, I would have been out of a job. I would have had to apply for an administrator job. So again, this isn't about me. This is about what's best for the county.
Well, it's about because you're retiring.
No.
So now we want to create something different.
No. What she's saying is she would have had to apply for it, but she is qualified to do it. She would be qualified to do it.
But-
But she would have had to reapply for her job.
Right, but Russell,
the new job.
I have been in favor of this for years, okay? But when I'm leaving, right? So it takes that whole issue out of the discussion. You don't have to worry about, do I want it? Don't I want it? Are you hurting my feelings? Am I qualified? Am I not qualified? It's a clean slate. It takes all that baggage out of the discussion. And all you have to worry about now is this the right thing for Waushara County? It isn't about Deb Berenger. It's about what is right for Waushara County.
So I guess that I would first like to say that part of the reason we're having this discussion is because in order to fill a position, whether it's a coordinator or an administrator, we are going to have to start thinking about what we want that person to do and advertising for it soon. Because there are lots of things that Deb's office and Deb herself do one time a year or one time every 2 or 3 years that nobody else knows. So the committee has already approved to hire somebody to shadow her and learn some of our policies and some of those things for a certain number of months. It started out that it was going to be 6 months. Now we've backed it down to 4 months. She's leaving in 8 months. You're not going to post this in the Argus and get an application tomorrow. You're going to have to put it out there. You're going to have to get qualified applicants. But before we can even do that, we need to know what we're hiring. Are we hiring a coordinator? Are we hiring an administrator? So that's the reason that we're talking about this now, is because we're going to have to come up with a job description so that we can start recruitment at the very latest the first part of the year. And that's coming right around the corner. And so we don't even know what we're hiring for. So we have to decide what we're hiring for. So that's just my general comment. Now, I, unlike Jeff, am going to talk for other people because 18 years ago, when you hired me, I also then became the chair of the department heads kind of nonchalant committee. And, you know, we meet on a regular basis on this, and we have talked about this over several months. And it is the consensus of the department heads that it's time to have something more formal. We need to start treating this county like the corporation that it is, with a $39 million budget that it is, as one entity. And for that to happen, we need to have somebody who is technically the CEO of the county. The county board is in place to set policies, but we need that one person who can make sure that all the rest of us are fulfilling those policies and running this county to the best of our ability. For at least the last 10 years, we've been talking about prioritizing our budgets. We didn't call it priority budgeting, but we were talking about what's mandated, what's not mandated, what can we cut, what can't we cut. And consistently, nobody has volunteered to cut programs, and I completely understand that, and nobody has wanted to make those hard choices on what to cut. This year, we came in over budget. We had departments stepping up to the plate and agreeing to give up money. We had money in other departments that had designated funds from rollovers able to help us out. That's not going to continue. Larry, you're absolutely right. We can't just keep going back to the general fund to cover our budget. Who's going to make those decisions as to what we're going to cut? What's mandated? What's the priority? So far, we have not been able to do that as a group. An administrator is not going to be tied to an individual's budget. They're not going to say, this is Ruth's budget, I can't touch it. This is Jeff's budget, I can't touch it. This is Terry's budget, I can't touch it. They're going to say, this is the Waushara County budget. The county board has directed me to come in at this number. How am I going to do that? And they are going to look at everything, and they are going to make some recommendations to you as to what can be cut to make that budget possible. You don't have to agree with it, but if then you decide, no, I really want this to still be in here, then either you will decide to cut something else, or you'll decide that this is important enough to take it out of our general fund. But right now, we don't have that. And we've talked about this over and over at the department heads, and I feel confident in telling you that it was the consensus of the department heads that this is the right step for Waushara County. So I'm asking you to please make a decision, one way or the other, so we know what we need to start recruiting. At the next department head meeting, which is the first Wednesday in November, the executive committee has asked us to start talking about what we would like this person to have as part of their job description, whether it's a coordinator or an administrator. Are we focusing on human resources? Are we focusing on finance? Are we focusing on something else? So we're going to be starting to kick around things that we would like to see in a job description. The executive committee at their meeting in November wants to start kicking around ideas about what should be in a job description. So what we really need from you is, what form of government are you doing? Is it a coordinator or an administrator? And then we can talk about the specifics of the job description at the next meeting. Thank you.
Okay, you kind of got us between a rock and a hard place here.
Yeah.
You're telling us to make a decision on whether we want what we've got now or if we want an administrator.
Yep.
I don't know what the job description is for an administrator. And if this is one of the things we're looking at, and this is something that you guys want, maybe by the next meeting you can have something, since you guys are meeting, get some kind of a job description put together that an administrator would have. It doesn't have to be exact, but so that we can look at it and have a good idea of what they do and how they do it.
Okay.
Well, again, every county does it a little bit different. So if you say you want this position, one of their duties is to stay with the human resources, supervise human resources, supervisor information technology. If you tell me that, that's a good starting place, okay? And we can take the rest of it from there. But I need to know, is that one of the things that you're going to want that person to do?
And I guess we didn't start on a job description because exec wanted to bring it to you guys first to see whether you wanted a coordinator or an administrator, because then part of it depends on experience and education and what you're looking for. It's hard to write a job description in a vacuum if we don't even know which direction you're leaning towards.
A year ago, we hired a new highway commissioner. According to this, administrator shall appoint and supervise the highway commissioner. Does that take all the power out of the committee? I don't want to lose somebody that we're very happy with because somebody on a whim wants to appoint somebody else. Is that, maybe I'm reading it wrong.
I think it's replacement. That's where the appointment comes in. They can't just arbitrarily come in and say, you're gone, and that's not going to be part of the deal. You'd have to have that clear conversation with them when they walk in the door. But as they're replacing people, they would have that appointment. But you're always going to go through that recruitment process. Anybody in that position is going to go.
All I have to go by is what's written here.
Well, the appointment is like the top. Okay, you're appointed, but that recruitment process isn't going to change. You're always going to go for the most qualified person. So it doesn't give word for word verbatim what's going to happen, but it's just like the Public Works Committee went through a recruitment process to find the person that they ultimately appointed, right? So that piece doesn't change. You're always going to recruit.
That part would not change. Thank you.
person can make all these decisions, though. I feel like, the administrator just doing everything. Firing and hiring, right?
But it has to go through the county board, doesn't it?
Well,
A department head?
no, just the
according to this,
elected
no.
ones are separate. So I guess the thing is, in reality, wasn't that kind of happening anyway? In reality, if you really think about it, when somebody had to be let go, it wasn't you guys that were doing it. So the reality of it was kind of going through this office anyway.
And I would think an administrator would, I think, meet with the committees before, and that's what we can put, in the job description, that, that they would meet with the committees before any action was taken.
I can see what Everett's talking about here, in several different places, where unless it's an elected position within an elected department head or whatever, it looks to me like, too, the county administrator would do the appointing and not the committee. And I think that's taking powers away from the committee itself.
I see the same thing with the health department, the local board of health. County administrator may assume the powers and duties of a local board of health. We're pretty proud of our board of health, and I just want to make sure that we're not messing things up. Now, I don't know enough about it just by reading this.
Well, one of the things is you guys design it. You appoint the administrator. If you don't like the administrator, you unappoint the administrator. At the end of the day, they report to you. So if you don't feel that they are doing the job that you want them to do, you hold all the cards. So, yes, yes.
You are right, Deb. Your office has been doing a lot of the discipline already. A lot. That's how you got the name.
I know, trust me, I know. But I don't, you need to be honest before Ruth and I and Melanie or whoever start spending a lot of time doing this. If you really don't want this, you need to say so. At the end of the day, you each have to vote on whatever it is. So if you're really opposed to this, you need to say it. None of us are strong-arming anybody into anything. So, but we need to know how we're going to recruit and what we're going to recruit.
When the city, do you hear me? No?
Yeah.
When the city went from a clerk treasurer position and moved to a city administrator, it's made a big difference, and it's a good move for the city. So I think it'd probably be good for the county also.
I think it's time for us to move to an administrator. I guess if you don't like everything in that, that you're reading in there, then we make some changes to that. But to throw the baby out with the bathwater is not the way to go either. Just because you don't like one or two things in the job description or what an administrator will do, don't be closed-minded about an administrator just because there are one or two things that you're not liking in what you see. We can work with that. We can work with it.
I think we have to look at the law as it's set out in here too, because as you read through here, some of them, it says that the administrator appoints the person, but the board has the say as to whether it's yes or no, but it's not that way in all cases. I was just looking at the vet officer in here. The administrator can say, yeah, you're out of here, or you're in here, and there's nobody else that person can go to. But I'm not sure what the statute says, so I'll read it and find out, but again, some of this may be, more than what we can handle because we can't control it.
Yeah, Yes, I would like to know what exactly is statutes in here, and it says here, county administrators, it says Wisconsin state statutes and elsewhere. Elsewhere where? Where do they come up with the ideas? Is this something that's tailored by each county as to what their duties of the county administrator would be? If that would be the case, I would be in favor of it.
Yeah, again, I'd have to check with Jay, who created this document, but my guess is some of that would be that the board is attaching that, those
Because
kind
the
of
elsewhere
conditions.
thing is a clue there.
I think we need to get, kind of a consensus on where everybody stands. And Ruth will hope of that without actually voting, on whether or not to do it, you know.
Good
How are
job,
we
just
gonna get this consensus without a motion?
maybe just a clearer job description of what that would be, of exactly what the duties, you know, the elsewhere and the statutes or whatever. I think we need to know if this is verbatim across the entire state for every county that has an administrator, or if they're different.
Well, some of the things are statutory, but I think you're probably right. Some of it's going to be job description driven also. And, you know, some counties have contracts. They have administrators under contract, and they do it that way. They're not considered a regular employee. So every county does it a little bit differently. That does administrators or administrative coordinators. I've seen that under contract also. So how about if we do it this way, since you seem really uncomfortable? Do you like the human resources piece to stay, whether it's an administrator or an administrative coordinator? I don't know who would do the human resources, quite honestly. It's really truly unfair to ask Ruth to take on more. So, would you want that to be one of the criteria? Is the human resources, the personnel piece of it? Okay, all right, okay, personnel, all right. What about information technology? So that's something I've supervised for 28 years, is you want somebody that has some of that background.
Yes.
Okay. Under the human resources piece of it, I do all the risk management stuff. So that's all the safety, that's all the PPE analysis, that, you know, that piece of it. Is that something you would want, you would just attach that to human resources? Yeah, just leave it as the administrator, administrative coordinator, okay. What about all the insurances? So do you want this position to be the one that's analyzing all the insurances and bringing those recommendations forward? So that would be liability, workers' comp, the property,
You pretty much do now, don't you?
yeah, so what you're saying is everything I'm doing now should stay in, whether it's an administrator or administrative coordinator, is what you're saying. Okay, well, that makes it pretty simple then. Okay, all right. Okay, all right. So I write 2 job descriptions.
Correct.
One's administrator, one's administrative coordinator. Okay, all right?
All right?
You got it.
Any
I'll
other
do it.
questions, comments? Speak now or forever hold your peace.
Till next meeting.
Not very far away.
Okay, next we're gonna do the 911 upgrade / maintenance agreement. You have that in front of you, Lee, from CenturyLink. This is something we've known for quite a while we were going to have to do, and the money has been set aside for it, correct?
upgrade is to the hardware and the software for our phone system, specifically the 911 system. Every public safety access point has this equipment, and it becomes obsolete in about 5 years. This is our turn to upgrade it. The proposal before you is for 5 years. The maintenance part of it, which would be 22,000, would be, we would ask that would be part of this process and be paid up front. Otherwise, that would be broken out over 5 years, and that would be something we'd have to budget for in those coming 5 years. This is the kind of equipment that originally was supposed to be paid for by the state 911 surcharge, but the state has commandeered that money, so we wind up paying for it. The money is set aside from savings from our 2015 budget, so the money is there to pay for it intact, and that's what's in front of you.
To approve. I'll second it.
Motion and a second. Are there any other questions or comments concerning this?
Was that Eckstein and Cap?
Yes, I'm sorry.
No, that's okay.
All right. Do we need a roll call vote?
Mr. Eckstein.
Aye.
Mr. Weddy.
Aye.
Mrs. Colada.
Aye.
Mr. King.
Aye.
Mr. Wadel.
Yes.
Mr. Rothermel.
Aye.
Mr. Kirschner.
Aye.
Mrs. Krantz.
Aye.
Mr. Heisey.
Aye.
Mr. Tim.
Aye.
Mr. Cap.
Yes.
11 ayes.
Thank you. Now, consideration and possible action on the following resolutions and ordinances.
Resolution number 24-10-16, support to secure state funding for communicable disease control. Tongue twister.
Motion to approve.
Motion by Weddy. Second by Bernadette. Any questions or comments concerning this? All in favor?
Aye.
Opposed?
Resolution number 25-10-16, resolution authorizing application for DNR Lakes Grant Diver Assisted Suction Harvester dash 3-year grant.
Motion by Bernadette, second by Everett. Any questions? Any comments? All in favor?
Aye.
Aye.
Opposed?
Ordinance number 602, ordinance amending Waushara County zoning maps pursuant to the authority granted in Chapter 58 Waushara County Code, zone change for James R. and Shelby A. Grassy, Town of Marion.
Motion to approve.
Motion by Waddell,
Second.
second by Cap. Questions or comments? All in favor?
Aye.
Opposed?
Resolution number 603, an ordinance amending Waushara County Code Article 3, Food Safety and Recreational Licensing Program.
Motion to approve.
Motion by Weddy, second by Eckstein. Any questions, comments? All in favor?
Aye.
Opposed?
Ordinance number 604, amending Chapter 30 of the Waushara County Code.
Move accept.
Motion by Cap,
I'll second.
by Waddell. Any questions or comments? All in favor?
Aye.
Aye.
Opposed? Same sign. Do we have any board suggestions for future agenda items?
Prior to that, I have one question, going back to unfinished business. Was there any further action required for that? Notice it says discussion possible action item for the budget.
For the budget?
Yeah, I can't see in the minutes where it was approved last meeting.
It's approved in November.
Oh, I'm sorry, I thought it was on the
I think
agenda
you were
for
in
today.
November.
I guess
Yeah,
if
I
you
did.
want to approve it tonight, Melanie'd probably be all for that.
Okay, I just wondered about
Just
that.
a question, Madam Chair. It says, next meeting, the second Tuesday. What's the reason for that?
That's state statute.
State
So
statute.
that they have
Okay.
enough time to
Oh,
publish
okay.
it.
I thought that was just annual meeting was. Okay. Just,
Bruce said we have to.
okay.
All right. Any other questions or any other suggestions for future items?
Motion to adjourn.
Oh, Russ.
Wow.
Motion by
Uh-oh,
Russ,
beat
second
Everett.
by Larry. Sorry, Everett.
Too late.
Too slow.
Question,
What?
maybe not so many reports next time. Our corporate counsel is ready to fall asleep. I agree with that.
Yeah, I don't know what to let- Get out of here.
All right, we are adjourned.
Everybody is ready to fall asleep.
Right.
I think so.
I'm gonna take care of that.
I said that we should have fewer reports because you look like you're ready to fall asleep. That was not a slam at you.
I thought you were hogging the microphone tonight.
Guys, I missed my nap today.
That's too bad.
That they have them install a second one just to keep Ruth happy.
Bernadette, you never take a nap. Huh? I never.
Thank you.
Nah, it ain't gonna be raining tonight. I gotta put the sound back on here.